Andy Johnson, Minnesota State University, looking at scaffolded oral reading, basic tutoring strategies, one part of some basic tutoring strategies, one part of a total program that you might consider. By the way, this is a form of neurological impress method. There is research to support this. So it's not just something I'm pulling out my butt. It is something for which there's research support. Now notice my use of language. I don't say that research proves that this is the best, because research rarely proves that one thing is the best for all students for all times. But I can point to some research studies that says this indeed is effective, and it is best used for students with severe reading disability because it provides structure so that students are able to read. It's done in small groups. Essentially, it is choral reading, reading together. However, you want to get just a little ahead of students to keep them moving. Neurological impress method is a fancy way of saying scaffolded oral reading. What you do is you put your finger on the word as you're reading, read the book or whatever, and the students follow along. If you're using a smart board or a power board or a chart, if you're using an actual book or a computer screen, your finger runs across the word and you want to keep just a little ahead. We are not concerned if students pronounce every word. We're expecting that the student will not pronounce every word. But it gives the students a sense of context, helps them develop fluency. They are understanding semantics as they read the story, right? So, finger on the word as you are reading. Scaffolded oral reading, good pace, you get just a little ahead of students, and you can expect some miscues. Again, the purpose is to develop fluency, letter-sound relationships, to strengthen word recognition and syntax. You may want to stop and talk and enjoy the story, ask questions, keep the child engaged as he or she is reading. And again, students with mild to moderate disabilities, or students, this is best for students with severe reading disabilities. If the student has just mild or moderate, you want the student to the greatest extent possible to use silent reading. Silent reading, because that is a more authentic form of reading. That means they have to practice with reading at the independent level. All right, let's end up this 10-part series, ending the session. Again, you want to end with a game of some sort. The goal is to have fun. At the same time, if you can reinforce letter patterns, excellent. Use sight words, phonograms, phonics, or spelling patterns in this game. You can play Hangman, bingo, concentration, limited by your imagination. Again, this deals with the affect, the emotion, the motivation. It keeps things light and fun. I have used rummy, and I actually tape sight words on each of the card, so the child is looking at letter, color patterns, and symbol patterns, and then at the end of the game, the child has to read the sight words as well. Again, overview. Sessions 40 to 50 minutes, more advanced 60 minutes, less advanced 30 minutes. Include the 5 elements somehow. Writing, word work, reading. Use scaffolded oral reading for severely disabled, silent reading for those who have mild to moderate. Do some fluency work, and end with a game. Big ideas. None of these strategies works by itself. All must be part of a total literacy program. And I said when students reach at about the 1st grade level, you can begin to leave that. At about the 4th grade level, you can begin to leave that. And I say begin to leave it. Always watch your students. Always watch your students. In the old days, this is all we did to remediate students who had reading difficulties.